holy night.
It's a lovely song. Would it help us sleep? Maybe not. Let's check in with the expert, Dr. Joe Ojile from the Clayton Sleep Institute, because I think this is a time of year when we all need to hear about good sleep hygiene. Dr. Ojile, thanks for joining us.
Thanks for having me. And should I be like snoring or something when you get on the line?
Teach us how to.
Yes, teach us how to. What is sleep hygiene and good sleep hygiene, Joe?
So really, generally sleep hygiene, and something we encourage, whether it's Christmas time or not, is really a fixed wake time and a fixed bedtime. So your body and your brain especially like routine, they like regularity, and they like discipline. It may not be the easiest thing for all of us to do, but it's quite helpful because your brain learns from that. And if you can do that and avoid getting riled up right before you go to bed, those are the first steps in good sleep hygiene and good sleep health. There's many more after that, but that's the beginning.
Joe, some of us fall asleep very, very quickly, but then wake up 2 hours later and then sleep fretfully for the rest of the night. What's going on?
Too.
Yeah, so that there's a common this happens commonly. There are usually varied reasons for it. We're not sure necessarily always what the reasons might be, but you'll hear when you go to dinner parties and so forth. And of course, you folks are going to a lot of dinner parties in your position. But when you go to these various parties, you'll hear people talking about that very thing, that they're waking up in the middle of the night. Some of that may be behavioral. There is a component that may well be hormonal. As hormones change as folks get older, both men and women will sometimes see an increase in wakefulness at night. But behaviorally, once people start to wake up at night, the key there is, if they don't go back to sleep in about 10 minutes or so, is to get out of bed and do something relaxing, something dull. Do not get on a phone. Do not electronic phone. Do check your emails. Don't get on a computer. But do something dull. Read a book that's maybe a little bit interesting but not exciting. For this very purpose, we learned from our patients. There's a wonderful website called Boring Books for Sleep. It's a free service, and you can go there and they read you books that are off copyright from the 18 and 1900s. They just read them to you very calmly, and they're not very exciting, and they just read you these books, and when you get sleepy and relaxed, you get back into bed. And the reason we have people do that is, one, if you start working on electronics, the next night your brain will wake you up to do those electronics again.
Or they can go to Amazon and read some of my books, and that'll do the job for them.
Well, as long as you have them in hard copy and not on the computer, then we can do that. So that's one thing. The other thing is that it is normal sleep. When we have people in the sleep laboratory, about every 90 minutes you cycle through all the stages of sleep, and your brain comes back up to awake. Folks in the sleep lab look around a little bit, and then they go back to sleep. And we think that's a residual reflex to make sure you're safe. And so it is normal to wake up during the night, but you should be able to go right back to sleep. So if people get up at night and they can't go back to sleep, we frequently see folks like that and work with them to try to extinguish that behavior. So it's a really interesting and common question, by the way.
So it's just a behavior. I mean, is there anything wrong with just laying there if you can keep yourself happy thinking thoughts?
Well, I mean, that's a very personal question, but I think that the issue really is what can happen is if that happens night after night. So if people wake up and they just lie there in bed and that goes on for 30 minutes or an hour, hour and a half, if that starts to happen repetitively, what happens is the theory is that your brain becomes retrained to think that your bed's a place you relax and not sleep. So that's why we want you to get out of bed, so that your brain associates the bed with sleeping.
Joe,
and that's – go ahead, I'm sorry.
No, I'm sorry. I didn't mean it. Go ahead.
No, your questions are what are important.
Well, I was going to ask about the sleep lab. I can't imagine going to a sleep lab and actually falling asleep in a different kind of environment.
It is one of the most common thoughts that people have about the sleep laboratory. Remarkably, the vast majority of patients, 95, really more like 98% of people, they get in the sleep lab and they sleep. And they do quite well. There is some subtle sleep disruption, and we can call that the first night effect in the lab. But by and large, we get quite good data. Now, over 70% of the sleep tests we do now are at home, not in the sleep lab, but we still have significant numbers of people that we study in the sleep laboratory. And I think, maybe Jennifer, you may have stopped by the sleep lab.
Oh my gosh, you wouldn't believe it, Don. I mean, there are these homey, comfortable rooms. You're allowed to watch TV, but only at a certain point. Then TV's off, lights are out, and you get in these beds, and it's not at all what I thought it would be.
Yeah, though that explains it to me.
It looks more comfortable than a hotel room. It's just very homey. Dr. Ojile, why do people talk in their sleep, laugh in their sleep, cry in their sleep, wake themselves up doing these things, asking for a friend?
I had the famous I have a friend. So, there are people who do, things during the night that aren't necessarily diseases or disorders. So sleep talking can be relatively common, and it can occur during different phases of sleep. It's, in some people, may be associated with either stressors, occasionally alcohol use. Some of it is certainly genetic. We hear people that, their mother, their father, their brothers or sisters, talk in their sleep. So it may just be an expression of either that genetic output or of a stressor. Now, if you start acting out things in the sleep or having more of a night terror type situation, and as an adult, we bring people in the sleep lab to sometimes try to make sure there's nothing else going on, for instance, like seizures or abnormal behaviors that would require an intervention. One of the more common things we see as people age is a thing called REM behavior disorder, where they start acting out their dreams. And in that case, once we diagnose it, we are able to treat it effectively with medications and keep people from hopefully harming themselves or being injured or injuring their bed partner.
But aren't we kind of frozen in our sleep, like we're trying to run or escape and we can't move?
Yeah, so that's a great question. During REM sleep, which should be about 20 to 25% of normal sleep, and where about 85% of dreams occur, when you're like that, usually you are paralyzed except for your eye muscles and your breathing muscles, and that's where the term rapid eye movement sleep comes from. So that's usually the case. But in some people, for whatever reason, that can start to break down, and people will start doing things like, as you described, running. The classic cases are someone thinks they're in the war and they start fighting, or they think they're in a fight or someone's challenging them or whatnot, and they don't actually know where they are, of course, because they're asleep, and they could injure themselves or injure a bed partner.
Is napping something that is a good thing for people to do, or can it be disruptive of nighttime sleep?
Well, it can be disruptive of their nighttime sleep, but the issue for us is, of course, it can be dangerous. If the person is falling out of sleep, they can break an arm, a leg, have a head injury. They can start walking. They could walk and fall down the steps, all kinds of things that we want to prevent and talk to them about. So, and it happens as people get older in the 6th, 7th, and 8th decades. It's not common, but it also is not rare. We do see it regularly.
But for people who might be really tired at 3 p.m., do you suggest a nap if it's short enough?
Yeah, so napping is a tool to use. So, for instance, and I know that both of you may have lived this life in the past where you were in that morning shift where you were coming in at 3 or 4 in the morning and then working, so you're getting up so early. Especially night shift workers can use this. Taking a very directed 15 to 30-minute nap in mid-afternoon can be a good thing to do. You don't want to take a long nap because that could cause you to diminish the amount of sleep you need at night. In the afternoon, as you point out, 3 o'clock is great because that's biologically when you have your normal dip of rest, of wanting to be sleepy, which is why in Europe they had the siesta at that time.
So that's universal. Everybody has a dip in energy at 3 p.m.?
Exactly. Well, mid-afternoon. So the folks from the ancient cultures were very smart. They understood biology quite well, and they had that scheduled. Whenever their natural dip was, they'd take that nap, and then they'd be ready to go for the rest of the day.
What about sleep aids? Good idea? Bad idea?
So you mean medication?
Yeah.
So our view of that is that we are pro-patient, and we are agnostic about medicines. If the patient's doing all the things correctly, if they have their sleep behaviors in very good order, they're getting up at the same time each morning, they're getting some light in the early morning, they're getting to bed at the same time, they're winding down prior to bed, all the things that we've talked about in the past in some of the interviews we've had here. If they're doing those things correctly, and the patient appears biologically to need either a sleep aid because that's their biology, or they need it because they have a lot on their mind and need to wind down, we do use sleep aids to help people if needed. But you want to have these behaviors well in order before you start just reflexively giving people sleep aid, unless they have a sudden acute stressor in their life. And you think about the things that are big stressors. A loved one who gets a sudden health problem. You get a sudden health, an anxious moment. They tell you have a sudden illness or a worry on your mind. Those are acute issues that sometimes we do have to give people a sleep aid for.
Dr. Joe Ojile from the Clayton Sleep Institute, thank you so much for sharing your wisdom with us. And really, the Clayton Sleep Institute is a very cool place. You'd be surprised at how comfy and homey it is and easy to try out. But it's always good to talk to you, Joe. Happy holidays.
Thank you, and to you as well. Enjoy and keep playing that good music.
Okay,
there you go. Thanks, Joe.
We'll take a break here. We'll be right back.